Hey guys, you're watching the Best Practices Show, where we take a look at the best business practices from the best dental practices all across the country. And if you're a dentist watching this, one of the things that you really want to do is find more of those patients that you love and find more of them to treat in your practice. And we actually have the guy with the secret of how to create a system to create find more of the patients you love, Dr. Ken Allen. So you are not going to want to miss this. Do me a favor, grab a pen and hit the share button. We'll see you in a second. Practices Show. I am having so much fun. We are having so much fun doing all these, and again, getting great feedback from all of you about the things that you want to see. And one of them is finding more patients that you love to treat. And so I have my good friend, Dr. Ken Allen, who is brilliant, and you're going to see that in just a second about how to do that. Now, couple show notes before we get started. We are shooting this live on Facebook, as all of these are. And we're loving the questions. So if you have a question during the broadcast, do me a favor, just type it in the feed and we'll ask Dr. Ken Allen directly right when you have the question. Or if you have a question later on after you're watching the show, please type it in there and you'll see Ken is great at getting back to you, making sure your questions are answered, because we want to make sure you're getting the things that you're looking for in this broadcast. And also, too, we just got approved for iTunes, so we are now in iTunes. So if you don't have time to watch these, you can listen to them at any time. And we're also giving away an Apple iWatch, the best question asked every week. We're going to be doing that later today. So, and 2 free tickets to Activate, which is our practice growth seminar. So don't miss that. Now, my guest today is a good friend, dear friend of mine for a very long time, and he's just one of those people that's been very, very, very successful and also extremely humble and very, very brilliant in his teaching, and you'll see that in a little bit. And we often take clients through a journey and help them get where they want to go, and then some clients go way beyond it, and you're going to see he's one of those people who's done this. And Ken practices in Fort Collins, Colorado. I'm going to get a chance to see you in a little bit. In a couple of weeks, when we're up there for the Seattle Study Club event. I'm really looking forward to that. But if people don't know who Dr. Ken Allen is, just tell them a little bit about your story, your journey, and your practice.
Well, Kirk, I moved to Fort Collins in 2000 after dental school. My wife and I moved out here with 2 young boys, and here we are 17 years later, and we've got 5 boys. We're not quite as young as we were 17 years ago. Not only do we have 5 boys, but we've got 1 daughter also. So the family has grown, the practice has grown, and the city has grown while we've been here. It's a wonderful place to be, and we're grateful to be out here in Fort Collins.
Yeah, it's a cool city. So I'm going to get to see it in a little bit. Now, you've gone through this journey and you've really developed your practice. And one of the systems that you created in your practice, I absolutely love. People call it patient identification. They can call it, filtering your patient base. Tell us why this system, before we get into the how, tell us why this system is so important in your practice, and especially in a fee-for-service practice like yours, as you're growing your practice.
Well, I remember years ago when we first started, we were just a 1 operatory practice. Every single patient who came in the door was just critical, seriously, so that we could put food on the table. And I remember the first time that I had a patient transfer from our office to another dental office. I thought it was going to be devastating, but inside I actually felt peace. And as I pondered that, I realized that I felt better and they felt better, and it kind of came up with a little mantra where I realized that patients are going to find a comfortable place for them to receive dental care, and it's going to be comfortable for the dentist and it's going to be comfortable for the patient. And so after that experience, I realized it's not a failure if a patient finds somewhere else to go, or if they go somewhere and they come back to you. It's always a success if they're finding a happy place to be, because inside I was also, interestingly enough, happier even though I was relying on every single patient to be able to keep food on the table at that early part of the practice. So fast forward many years to when I met you and I heard about this patient categorization system or the patient ID system. And you talked about how you had your A patients, your B patients, and your C patients. And that's when all of a sudden it started to click. I realized that when I was treating patients that were my A patients, then I was really enjoying the treatment I was doing. They seemed to value the care that I provided. I valued providing that care, and everybody was happy. There was also a big group in the practice of people who, I mean, nobody really loves coming for dental treatment, but they tolerated it and everything was cordial. There was also that little group in the practice of what you referred to as C patients, who didn't quite fit into our office values, our office philosophies. And so things were always stressful. Those are the ones that when they would find another dental office, we'd probably both feel a little better. Right. As long as they were in the practice, we were happy to treat them and we'd take great care of them. But when it comes down to relationships and to having a comfortable experience, I think they felt better somewhere else, and we did also.
Yeah. So I just want to piggyback on this too, because this can be somewhat controversial. People are like, well, you're pigeonholing patients. And really what you're doing is you're just identifying their behavior or their value system. And I got to say this as loudly and as clearly as I can. As a dentist, there's nothing better than looking at a full schedule of people that value what you do. And you're going to see there are people that value what you do and there are people that do not. And when you spend your time trying to take care of people that do not value what you do, it affects how you communicate with the people that do value what you do, and it just makes for a miserable experience. Your favorite patients have the same value system that you do, and so we often just flood our practices and our schedules with everybody and don't pay attention to this. Now, one more thing too, Ken, I want to say this. Every single business in the world does this. So when I fly Southwest Airlines or anything, there are separate lines and separate phone numbers for what they would consider their A clients, because they know sometimes more than 80% of their revenue comes from 20% of their client base. So this is not new to dentistry. This is just you as a dentist in the United States of America in a fee-for-service environment saying, this is who I am, these are the people I like, and I want to spend most of my time with them. Is that correct in assessing that?
Yeah, absolutely. But I gotta be honest with you, Kirk. The very first time I heard you put this A, B, and C, it resonated with me that, oh, that's why I didn't feel bad when that patient left. Mm-hmm. But I also left thinking, that's a bunch of baloney. Mm-hmm. There's no way that I can say that's an A patient, that's a B patient, and that's a C patient, because I misunderstood what you said. I understood that what I needed to go back and do in my practice was determine who was the A patient, the B patient, and the C patient. Right. And I think right there, that's where a lot of dentists get into trouble. They fall into this little rut of saying, how am I going to determine who's the A, the B, and the C? Right. And what we determine in our team is you don't have to do that. It's too hard. It's not fair. And you're just judging people. The secret for us to having a good patient categorization system and to treating more people that you love treating is to let them determine by their actions and their behaviors if they indeed are an A, a B, or a C. Yeah. You sit back and treat everybody the same and then let them treat you as an A, B, or C. And then reward them if they're an A, treat them good if they're a B, and still treat them good if they're a C, but don't necessarily reward them with all the perks you'd give the A. Yeah. Just like Southwest Airlines, if you've got that person who's always arguing with the flight attendants and who wants to have 10 bags of peanuts and he's really hard, you don't put him in that special priority boarding line.
Right. Right. Absolutely. Now, you have a system for this, because this isn't just something you just say, oh, let them kind of go where they go. You and your team sat down, you wrote an entire system. You've even made some modifications to it just this year. And so, first of all, if somebody doesn't know what a system is, tell them how you create these systems, because this is something that runs by itself after you've created it, well, with the help of the team. And how did you do that?
So, a system is a key business process that frees you up from having to make decisions over and over again on how you're going to treat your patients in the same situation. So, for example, in the patient categorization system, we identified what are the traits and behaviors of the patients who we would consider A patients. What are the traits and behaviors of those who we would consider B patients, and what are the traits and behaviors of those who are C patients? Once we clearly identify that with our own practices, values, and ideals, then we determine how are we going to treat each of them. Just like you might have with Southwest Airlines, you might have a rapid reward program. In our dental practice, we have different benefits that we're going to give them with trying to bend over backwards and provide phenomenal service for our A patients, where with our B and C patients, we're just going to provide excellent service because we want to treat everyone really good.
Absolutely.
So as we sat down as a team, we really had to first identify our practice's vision, our goals, and our philosophy. And once we knew who we were and we had a really good read on what was important to us, we could identify the traits of A, B, and C patients. Mm-hmm. So in our system, for example, an A patient is simply any patient who follows the practice's financial policies and who doesn't have what we call a schedule alert or a schedule alert 1. We'll get into these schedule alerts in a bit because that's an integral part of it. But basically, they respect their financial commitments and they respect their commitments to their appointments. Right. They honor their time and they honor their money commitments.
Right. And this has nothing to do with how rich they are, or what social circles they run into, or who they're related to, or anything like that. It's purely, do they show up and do they pay their bills, right?
Absolutely. In fact, some of the patients that I enjoy just from personality wise are C patients. I mean, they're just fun to be around. But if I had to count on my living based on those fun people, I'd never be able to take home an income. Right. And so I need to have people who are going to respect their financial commitments and who are going to respect the commitments they make when it comes to making appointments and keeping them. Mm-hmm. So our B patients are similar. They have what we call a schedule alert 2, which we'll get into, and they once again keep their financial commitments. C patients are any of the remaining patients who have what we call the schedule alert 3, meaning they've missed a number of appointments, or anybody at all who's not complying with the practice's financial policies.
Okay. All right. And then you even have a D patient once, but we'll talk about that. So, yeah. so define what a schedule alert is and how that works in your office.
So we've all had the experience where somebody ends up canceling their appointment or not showing up to an appointment. In order for this patient categorization system to work in our office, it's intimately tied into a second system, and that is our last-minute cancellation or failed appointment system. And in that system, we define very clearly for the team members how we handle failed or canceled appointments. So our definition of a failed appointment is any appointment where the patient simply does not arrive for their appointment. Right. And a canceled appointment is any appointment where, in our case, they don't call to reschedule with at least 2 business days notice. That's in our policy, and the individuals understand that when we tell them that very clearly as they come in. So if somebody fails an appointment or cancels an appointment, then they receive what we call a schedule alert. Every new patient who comes into the practice has no schedule alert. But anybody who cancels or fails an appointment receives initially what we call a schedule alert 1. Okay. So when they call to cancel, our first inclination is always to attempt to salvage the appointment. Mm-hmm. So we try to remind them of the commitment that they made to the appointment. We certainly express a lot of compassion. We listen to them, and we do everything we can to try and salvage them. Let them know that we've set aside this time specifically for them. And then we use the system as the fallback. It would be something like this. Oh man, Kirk, that's horrible that you need to stay there and wait for the dog groomer to come and take care of your dog. When you scheduled this appointment, we set this time aside specifically for you. Our system is set up so that if you don't make it to this appointment, I'm not going to be able to schedule you for 2 more weeks. Is there
Mm-hmm.
any way you can make this? I want
Right.
to make sure you're successful in keeping your appointment.
Right.
Now, things happen. And one of the big issues that the team members came up with is they said, well, what if they have a death in the family? Or what if they're ill? Or what if? What we tried to do in these systems is take out all of the emotion and all of the what if. There's 3 different tiers of schedule alerts. And we don't want to have to judge the reason why they canceled or failed.
Right.
So we always try to salvage an appointment when they call to cancel. But if they're unable to keep it, then we give them that first schedule alert. So the first time they do that, they receive what we call a schedule alert 1. And the schedule alert 1 means that they cannot reappoint for 1 to 2 weeks.
Okay.
And when we do reschedule them, they need to reappoint with a firm commitment.
Yeah.
So
Now,
we'd
can I
say-
just ask you a question on that? The schedule alerts in your software, now those happen automatically. Are they automatic when that happens, or does the team member manually enter in a schedule alert within the software? What software do you use to do?
So we use EagleSoft in our practice.
Okay.
And the key to making this system work for us is using the software to automate the system.
Okay.
And so what we've done is we've created alerts. Every software has a patient-specific alert. You can have an alert if they need pre-medication. You can have an alert if they need to use a wheelchair, whatever it is. So we've created a series of alerts. And the first alert says SA1, 1 to 2 weeks, firm commitment.
Okay.
So anytime a patient's record is accessed who has a schedule alert 1, we'll have a little window pop open on EagleSoft that says SA1, 1 to 2 weeks, firm commitment. That reminds whomever it is that is speaking with that patient that this person has a schedule alert 1 and they're still an A patient because they just have a schedule alert 1, but we need to make sure that we remind them that they have a firm commitment when they come in so that they don't move into a schedule alert 2.
Right.
You see, communication is the key here.
Yes.
It's not fair to be giving people these schedule alerts or dinging them if you never told them what the rules are.
Yeah. Now I'm going to go back to what you said. You're telling patients when they try to cancel for the first time, number one, you're giving them concern on the phone. You're not trying to be tough with them. You're also telling them, we want you to be successful here. Can you just talk about that? Because you are giving people the rules up front.
We are. Well, when they very first come in the new patient paperwork, we go through and we have a little discussion and we say, we want to provide the optimal care for you. And in order to do that, we're going to set aside some time. And we would ask that you set aside time and respect the time that we set aside. So when you schedule an appointment, please make sure that it's a time that you know that you'll be able to be here. And we'll make you the same commitment that we know we'll be able to be there when you come also.
Right.
If something happens, we ask that you give us 2 business days notice because we know life happens. If you're unable to give us 2 business days notice, then we have a system in place where it will be more difficult for us to be able to continue to schedule you, because what that will do is what will prevent other people from being able to get in, because you'll be taking space that others could have taken. Now, that's a very direct system to have that discussion with them, but having that discussion and sharing those rules up front helps them to respect the priorities. Once they understand it, it's good.
Yeah.
The key, though, is saying it with compassion.
Yep.
And also letting them know that you're going to play by the same rules.
Yeah. I want to point out that because you use the word respect, that's very important, because as a dentist, it's really easy to create a practice in which people like you but don't respect you. So, you and I talk about this all the time. We teach people how to treat us. And a lot of times team members aren't trained on how to communicate with a patient and tell them what to expect. And so what happens is a patient cancels and your team member says, oh, that's okay. Well, what you've done now is you've essentially taught the patient that's okay, and the behavior repeats itself, and eventually the patient keeps kicking you in the shins and you keep giving them Snickers bars as a reward, type of thing. And so it continues on and on and on. And the other thing I want to just mention too, because I do get this question, and I'm going to ask you, what about a cancellation fee? Doesn't a cancellation fee, how do you feel about cancellation fees in your practice?
Well, we've had so many team meeting discussions about cancellation fees. To me, we do have room in our practice policies for a cancellation fee, but a cancellation fee for me is a way to encourage a patient to leave and go elsewhere. Mm-hmm. Most people who receive a cancellation fee, that's kind of the nail in the coffin. Mm-hmm. That's where it says, these guys don't even care. My father was in the hospital, so I had to miss an appointment. My mom was sick the next week. All these horrible, unfortunate things happened, and they didn't even care. So rather than having to judge it and be the people who don't have compassion, we just let them know, based on the history of missing appointments, our system only allows us to schedule you out this far.
Right.
So initially with the schedule alert 1, we can reschedule them in 1 to 2 weeks if they give us a firm commitment.
Right.
If they get a schedule alert 2, we can reschedule them in 3 to 4 weeks if we get a firm commitment. When they get up to what we call the schedule alert 3, then at that point we have the discussion with them that it sounds like our schedules aren't mixing, or they're not meshing very well. Mm-hmm. We need to find a day when you're available and we're available to have that appointment. My system's not going to allow me to put an appointment on the books, so we will call you on a day when we have free time, or you're free to call us on a day when you know that you can come in, and we'll see if we can find a time that works.
Yeah, and you're putting it on the patient now, saying, hey, look, if you want to be here, you call us and we'll see if we can fit you in now. And that becomes interesting. The other thing I want to point out too, so if you're watching this, you can see what we're doing is we're collecting data. So what Ken said at the beginning is exactly what's happening now. It's not about judging. We're now collecting data because now by the time they've reached a schedule alert 2, schedule alert 3, you're starting to see a pattern in their behavior, which makes it less emotional to have these conversations, right?
Absolutely. And it's critical that any time that a patient receives a schedule alert, that's documented in the patient's record. An account note is made so that we can come back when we have that discussion and say, well, yeah, this happened on April 24th. You had missed your scheduled appointment. Some people are going to want to get into arguing, no, I've never missed an appointment. And if you have that data, sometimes that's helpful. We don't want to be confrontational, but the data is important. It helps the team members feel better as they go through.
Yeah. And I want to point out one other thing too. Cancellations, when you have an open chair, see why the system is so important. When you have an open chair, it's not no profit, it's negative profit. I mean, you're actually losing money. And then if you multiply those cancellations, so if your hygienist has 1 per day, you're cutting the profit in half, probably, depending on the nature of the practice. You have a second one, you're now working for free. Third one, you're now losing money in that hygiene department almost every single time. So cancellations are a very big deal in dentistry. And what's more importantly, globally happening in a practice, as you hear Ken talk about this, is you're now starting to, whether you want to call it prune or massage, or really start to be intentional about building a patient base of the right type of people, because these people refer other people and they know the deal, right? They're highly referred and they know, oh, I can't cancel in your practice, or I can't miss an appointment, or you're expensive. Is that what happens as a result of sometimes creating these systems?
Oh, absolutely. I mean, take it back to the classic example. How many individuals who have to book out 2 or 3 months ahead for a hair appointment are going to miss that hair appointment? It just isn't going to happen because there's so much value for them to visit with that perfect stylist that they will move heaven and earth to get to that appointment. And so we want to make sure that the value is there for the dental appointment. Mm-hmm. And the way you do that is you give people the ability to make their own decisions. You don't force them and pigeonhole them into a certain time. You give them options of when they can schedule. And then as they schedule it, say, now that you're scheduled here, can you commit to this time? And we'll commit to you also.
Yeah.
Now, the evil twin sister to cancellations are these failed appointments, and they're
Okay.
almost worse than a cancellation. In a cancellation, at least we get to talk on the telephone and have the conversation with somebody. But with a failed appointment, they don't show up, and we rarely get to talk to them. And so the system for a failed appointment is at 7 minutes after the hour, the clinical team member, whether that's a hygienist or the dental assistant, picks up the telephone and calls the patient, tries to get them on their cell phone or their home or wherever. And their whole purpose is to express concern. We're not there to chew them out.
Right.
We're there to express concern, almost astonishment that they're not there on time. Is everything okay? Are you all right? We were worried about you. We want to make sure everything's okay.
Right.
Oh, I got stuck behind a train. Oh, we're so glad you're all right. How soon can you be here? Okay, I will be waiting for you. Right. And then a key part of this system is that team member, after hanging up on that phone call, if the patient's still coming in, leaves wherever they are and goes into the reception area and waits for the patient to walk through the door.
Wow. So they sit right up at the front door and right in the reception area and greet them personally?
Yeah, they don't have an opportunity to slow down or stop. When they come in, you already alluded to it, Kirk. You said, they say, oh, I'm sorry I'm late. And then you say, oh, it's okay. No, it really isn't okay. But when they say, I'm sorry I'm late, you say, I am so glad you're okay. Come with me. Let's get done what we can get done today. And we take them straight back into the operatory, and that's where we really fast track it so that they can see that we have urgency, and where they may not have been able to keep their end of the commitment, we're definitely going to keep ours. Yeah.
Now, I love your verbal skills there, because the question that comes up is the cutoff time, whether you see the patient or not. And if you're watching this, you just notice he lowered his expectations with his verbal skills. So answer the question. Do you that I get all the time, do you not see the patient? Do you see the patient if they're 15 minutes? You said 7 minutes after you call, but is there a certain point where you won't see the patient or you'll still see them?
Look, if the patient made the effort to come in, I will always see them, but I won't guarantee that I'm going to be able to finish what they came in to do. Okay. It's not fair to every successive patient for me to not respect their appointments because somebody else was late.
Right.
And so I will do what I'm able to do, and I explain it to the patient as I come in. I'll say, oh, Kirk, I'm so glad you're here. Let's get done what we can. I don't know if we're going to be able to finish everything, but let's do what we can. Right. There's times when they come and we just don't even have time to deliver anesthesia or even get started. And so then we just will have a talk and we'll say, we're glad that you came. What can we do next time to make sure that we schedule a time so that we have enough? It is about the relationship.
Yeah.
It's not about the task of completing the dentistry, to me. And maybe other practices have different values and philosophies. But to me, it's about finding those individuals that value my care and that I value their care. And if they seriously were caught behind a train, or if they had a little child who was sick and they bent over backwards to try and find a babysitter to take care of them, and then they come in 20 minutes late to their hygiene appointment and it was so hard to get there, and I say, I'm not going to see you because you're 20 minutes late. Well, what am I telling them? Right. And so I'd rather do anything I can. In hygiene, it may just be that the doctor can do the exam and we get radiographs. Yeah. But for me, I want them to know I'm here for you. I'm doing what I can.
Yeah. And you're also being clear too. One of the things when we talk about it's better to be clear than nice, we're not asking people to be mean. You're just a perfect example of how you're clear with people. Say, look, I love having you here. We're going to build this relationship on trust and I'm going to take great care of you. But we are expecting you to show up on time for these appointments. And you're not letting them off the hook. I also like the fact that you asked an open-ended question at the end of the appointment instead of telling them they have to show up. You said, how did you say that? You said, how can we make sure that, or how can we help you be on time for your next appointment? Why is that so important to ask that kind of a question instead of saying you need to show up on time?
Well, I kind of get in the flow and I don't remember what I asked, but open-ended questions are critical because you're not directing a specific response to somebody, and you're allowing them to go back and think about their behaviors and their responses and to reflect their values back.
Yeah, absolutely. And they're also going to come up with part of the solution to why they're late and why that won't happen again. So it's good stuff. Good stuff. Now, what happens when you start getting down to schedule alert 3? Tell us about that and what starts happening at that particular time, because I would imagine it doesn't happen a lot for you, but it may be happening a lot for a dentist that's watching this.
Well, I mean, listen, Kirk, we're like any other practice. We have plenty of patients who have schedule alert 3s. It happens all the time. So I feel like I was a little unclear as I kind of explained the schedule alert 3s and how they relate into the categorization. So if you don't mind, I'll do a quick little synopsis.
Please.
All right.
Please.
So a schedule alert comes anytime somebody fails or cancels an appointment. And the first time you get a schedule alert 1, which means you schedule them back 1 to 2 weeks later with a firm commitment. The second time they get a schedule alert 2, which means you schedule them 4 to 6 weeks with a firm commitment. And the third time they get a schedule alert 3, which means they are only able to schedule same-day appointments. Whether that's from us or from them, only same-day appointments are available. If we've got room to treat them, we want to treat them and take care of them. Now, that ties into categorization because a patient that has no schedule alert or has a schedule alert 1 is an A patient if they keep their financial obligations. A patient that has a schedule alert 2 is what we call a B patient. So that would mean you could have patients who have missed or canceled up to 2 of their appointments and still be in good standing in my particular practice. Right. We're not trying to throw everybody out. A patient who's missed it 3 or more times, they're the schedule alert 3 individuals. And so you ask what happens. Well, there are a few changes. First of all, only A and B patients are allowed to pre-schedule hygiene.
Okay.
So we always try to pre-schedule our hygiene appointments 3 to 6 months ahead. At the end, we want to pre-schedule our hygiene. But if I have a C patient who's a schedule alert 3 who got in on a cancellation or something, I'm not going to pre-schedule them.
Okay.
If I have a B patient, so someone who's a schedule alert 2, I can pre-schedule them, but only with an extremely firm commitment. And so the whole team has to be willing to have these hard conversations where we say, hey, Kirk, I'm so glad we were able to clean your teeth today, get everything nice and shiny. I'd like to schedule your next cleaning out 6 months. You remember how you've had these issues in the past of having a difficult time making it to your appointments. We don't want to hold that over your head, but with the system, I have to find a time that's going to work with your schedule and mine. Do you know a time that will for sure work in 6 months? Because if you don't, it may be better for us to contact you in 6 months and get you on the books then.
Wow. See, now the way you said that, I'd be nervous to miss that appointment. I'm going to work extra hard. And then you're also telling them, look, if you're going to be flaky with this, then let's just go to option B and you call us when you're going to be available. I love that.
But it needs to be non-judgmental
Right.
because there are some people who say, I can't even schedule anything in my life. And so they would rather be contacted 6 months out when it's time for their hygiene.
Right.
That's fine. We'll go old school with them and send them a recall card.
Right.
Our A patients, those who have no schedule alerts or have a schedule alert 1, we always try to schedule them 6 months ahead, but we always say, let's make sure we find a time that's going to work, and we go from there.
Yeah. So, and again, I'll go back to what you were talking about before. You can see now, not only in the restorative schedule, but in the hygiene schedule, you're starting to really focus on those people that are going to show up because your practice is growing like crazy and it's growing from a lot from referrals and a lot of the great things that you're doing. But now you're building the schedule 6 months out where those people are expected to show up and they do show up. And then the other thing you've shared with me in the past is people can change their classification. So by better behavior, is that correct? So take us through how that works.
Absolutely. I mean, we all want to hope that we can rehabilitate somebody.
Right.
Once again, I don't know that we can rehabilitate anybody. They need to rehabilitate themselves. So this whole system is based on the patient and their own demonstrated behaviors. So we have in our system part here. I'll look here. It says, as the patient's actions and commitments to their appointments improve, team members are authorized to lower the schedule alert tiers one at a time. And the way we do this is when they have not canceled or failed for 4 consecutive appointments over at least a 1-year period, then we'll back them off one. So let's go worst case scenario. Say we have a Schedule Alert 3 individual who's had to call in now for 4 prophies. And but they say, wow, I really value your services. I know my schedule's out of control. I've had to call in, but I've made it through. Then we can say, you know what? You've done fantastic, Kirk. Because you've demonstrated that you're reliable on this, I'm going to back you down to this lower tier here, and we're going to try one more time. Can you find a time that you can commit to scheduling in 6 months? If you can't, don't give it to me. I don't want to put you back into the same boat. But if you can find a time, I would love to schedule you. Yeah. It's all about, instead of sitting there trying to be an authoritarian, telling them what they should and shouldn't do, and you're bad because you missed the appointment, you want to make the system the bad guy, if you will. And you're the patient's advocate saying, look, I know how to walk through this minefield, and I'm going to link arms with you, and I'm going to help you be successful.
Yeah, I love that phrase. You use that all the time. I'm going to help you be successful. And let me share with you how you can be successful here. You do that with team members. You do it with your patients. Now, I did get a question. Iris, my good friend Iris asked this question. Hey, Kirk, what does he mean by firm commitment? I think you shared it, but and then is that a financial commitment when you say the phrase extra firm commitment? So can you just give a little more clarity to that?
Sure. And so you can get a good feel if somebody's commitment is firm or not by if they're using active or passive language. Okay. For example, if Kirk invites me, hey, can you come on May 6th at 2 p.m.? Yeah, I'm pretty sure that's going to work out. I mean, I don't know of anything else that's happening. That's a flaky commitment. That's not a firm commitment. But if they're like, let me check my calendar. Yeah, I have nothing else. I can totally make it at 2 p.m. Then to get the firm commitment, after they've cleared it and looked at it, then we come back with an active question, what I would call a will you question. Great. Then, Kurt, will you be here on May 6th at 2 p.m.? Yeah, I'll be there. So the key is commitment. You want to make sure that they've made a commitment to be there. Because if it's just kind of hanging out there in the ethos, then they can come if they want, and they don't have to come if they don't want to. But you want to make sure that that's something that's important to them.
Yeah. Now, you also, when you talk about the financial commitment, or Iris asked, you actually had a patient that was a D patient. And talk about, and they had already paid because you knew there was a chance. Now, can you just describe that and how you guys dealt with that?
So, I mean, this system, we're constantly updating it. Like Kirk said, we've actually updated it twice this year. But at one point, we thought, hey, you know what? If we make our patients with Schedule Alert 3s prepay for the appointment, there's no way they're going to miss it. Well, I mean, this guy's life was so out of control that we thought we'd try it. And so we said, hey, so-and-so, look, we're going to have you prepay for your cleaning because you've missed 3 appointments in a row. He called up. He says, look, I've got time today. We had a hold on the schedule. The receptionist took a credit card over the telephone. He'd paid for it. His appointment was actually in 45 minutes. He said, I'm in the car. I'm driving there right now. He didn't show up, you know? And once again, going back to personalities, he was one of my favorite patients. Just a great guy. I mean, I loved chatting with the guy. He was fun. It was terrific. But when it comes down to running your business and feeling inner peace and finding someone who values what you do, it wasn't a match. Right. I don't want to judge him as being good, bad, or anything else. I just say that he and I weren't on the same level when it came to a business commitment. So they need to respect our financial policies, meaning our financial policy is that they need to pay for their services at the time that we provide them. And so if they're not doing that, if they're not paying when we provide our services, then they automatically go to that C categorization.
Yeah.
I don't know if that answered the question well or not.
It did very well. Now I want to speak to this because I do get this pushback. You're let's say we're both in our mature ages, and there's something about maturity that's good. When you get older, you just have less tolerance for the way things used to be, and you're a little bit more stronger with the things that you believe. If I was a young dentist watching this, because I do hear dentists say, well, that's great, but you don't understand. I got to see everybody. I'm on a lot of insurances. Can you speak to that journey as a young dentist? What would you say to that young dentist who would say to you, look, Dr. Allen, I would love to do that, but I've got to see all these patients and I'm still in the building phase. What would be your answer to that?
Well, you started alluding to it a little earlier about when you have a cancellation or a no-show, you're actually starting to go into negative cash flow. Mm-hmm. I started thinking about this. I'm not an economic genius, but if I have a hygiene appointment, let's say, and it's worth a simple number of $100 for that 1 hour. If the patient doesn't show up, then I lost the $100 I was going to make there, and I also lost the $100 of the person I could have put in there.
Right.
But I also lose the $100 for when I reschedule that patient that didn't show up. And so now it's costing me 3 times as much. And this is where I'm not an economic genius, but the way I look at it, I'm actually losing it again because I'm losing a fourth $100 for the person I could have put in for that next one. So whether you lose $100 or $400, you're losing a lot more by having a cancellation or a failed appointment there. Mm-hmm. And so as I look at it, with my practice style, it's relationship based. It's about people rather than tasks. Mm-hmm. And so I found as I grew the practice, I could get a lot more done building relationships with my free time than I could keeping myself super busy with small little things that I wasn't getting paid as much for. Right. So rather than killing myself so that I can see 20 patients in a day, I'd rather slow it down and see 6 to 8 patients in a day and be able to build a deeper relationship with them.
Right. And with a deeper relationship comes more trust and comes more, you could look at the economics on the other side without even taking a look at it. You can already assume what's happening. Value per patient is much higher in a practice like this than it is a practice where you're just seeing tons and tons of patients per hour.
Yeah, it's a hard thing, though, when you're a new doc and you're coming out, then you see, wow, I need to have patient flow because that seems to be king. Really, what is king is profit. And so you don't just look at how much you produce, you've got to look at what the profitability is there. And as you start to get more gray hair, all of a sudden, the real payoff is how much happiness your profession brings you.
Right. Right. Yeah. And once you cross the 40 threshold, I like the word joy. Your day has to be more joyful than ever. I mean, at least for me, it's not really about money anymore. It's about, hey, how do I enjoy this entire day? And part of it is really having great systems in place where you've got people that want to be there. Now, I want to speak to this too, because when you have a small practice, you don't need filters or systems like this. You can just come up and say, she's doing this again. Let's reschedule her. And you start to call audibles on each patient. But when you really start to grow, that's when you really have to tighten up. So again, what you said earlier, we're treating everybody with the same level of professionalism, excellence. And this isn't judgmental. Now people are filtering themselves. And over time, it multiplies into patients you want to see.
Well, that's exactly where we've had to make 2 of our changes to the system this year is because now we're in a new growth phase. And so not everybody knows every patient in their history. So we've had to do a couple new schedule alerts that show up. For example, if a patient calls at night and leaves a message on the machine canceling their appointment, then we've never had the opportunity to discuss with them that they just got a schedule alert. We didn't have an opportunity to try and salvage it, and we didn't have an opportunity to let them know the consequences of them canceling it. Mm-hmm. So one new schedule alert that we've added on is what we call the schedule alert communication. It just sits on there saying, look, communicate with the patient that they just went up one level on the schedule alert. So they may have a schedule alert 2 on their account, but if this schedule alert communicate comes up, it means they used to be a schedule alert 1. You need to tell them this 2 that they have is new and they don't know about it. Mm-hmm. I mean, you've got to let people know. The system won't work if you have even one team member who's not willing to have kind, compassionate discussions with the patients.
Right. Now, can I just ask you a question about that? Because you guys do morning huddles, and are you communicating this as a team in the morning huddle when these schedule alert 2s communication things show up, or is that something that the team member does individually on their own?
Yeah, we communicate it. In Eaglesoft, you can attach an icon to certain alerts. So if somebody needs pre-medication, you can have it put an icon on the schedule. Mm-hmm. Of a little pill or something. So what we created is for each of the schedule alerts 1, 2, or 3, we put a little A, B, or C that helps us see easily on the schedule at any time what they are. Is this an A patient, a B patient, or a C patient? So we can always see it right in front of us. Mm-hmm. So when we're looking at our huddle, we can see it immediately. We don't have to pull it up anywhere. It's always in front of us.
Mm-hmm. Now, I do get this question because I have a lot of practices that do this. What happens if a patient sees their grade accidentally or whatever? Have you ever had that happen or not?
If they've seen it, they've never said anything about it. Right. But let's say that you have a patient that sees SA3, mm-hmm. same day appointment only. I mean, what would you do?
Just tell them the truth.
Yeah, what is that? Oh, well, do you remember how you missed those 3 appointments? Yeah. Mm-hmm. That just helps us understand that we're not able to pre-schedule you. I'd love to get to the point where we can pre-schedule you, and let me tell you how to get there.
There you go.
All we have to do is make sure that you keep the commitments you make, and we'll bring you right there. We'd mm-hmm. love having you as a patient.
Yeah. So you said you added 2 schedule alerts. So the first one was the SA communication, and which one was the second new one that you added?
Well, the second new one is an interesting one. We've got a lot of patients who had left the practice years ago who seem to be flocking back to the practice in droves. And we're so grateful for that. But some of those patients had bad habits of failing appointments and canceling. Mm-hmm. And so it's really hard to have a new team member who knows nothing about their history deal with that. And so we have an SA4, basically, that we call it, which is don't pursue this individual. I guess I'll give you an example. We had somebody call the practice a few months ago and say, hey, I was in there 6 years ago. I really loved the care that I got. It was wonderful, and I want to come back, but I'm not a bend-over patient. We said, the receptionist said, well, what's a bend over patient? And she says, I'm not a patient who's going to bend over for anything that the doctor says I need to have done. Mm-hmm. And so the receptionist said, can you give me an example? And she said, yeah, my current doctor thinks I need to have x-rays, but I know that's going to cause cancer. Mm-hmm. Well, so, I mean, there's some communication that needs to happen there, but there's also a caustic, toxic attitude, which had been identified 6 years previous.
Right.
So there are some of those personalities that we've gone through and put a SA4 on that says, don't pursue them. If they want to come back to the practice, schedule them, but go ahead and treat them very, very carefully and make sure they're extremely clear on what our expectations are up front, because we don't want to get burned right off the bat again.
Yeah, and see,
So
you're just being a really nice person for saying for a categorization for crazy people, So if a woman brings in a shade guide at a consult, I always say, or if if you're the fifth dentist she's seen, and she's got a bag full of splints. I always joke, but people always say, there's no woman that brings in a bag of splints. You wait, you practice long enough, do high quality dentistry, you're going to see a woman bring in a whole bag of splints. And you're going to go, whoa, 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 time out, time out. And really, it's not that they're bad people. You're just making a decision. Look, I want to deal with healthy people here, and you've got to follow my rules, and here's how to be successful. So do you use the SA4 a lot or not so much?
Pretty much only on my family members.
Or friends. Yeah, absolutely. Friends, uncles, all that kind of stuff. Yeah, that's funny.
It's just to kind of, as you get new team members, it's just to give them a little heads up that you better be very clear in your communication. Right. And so those team members who've been here for a long time, we've gone through and said, just be careful with this one. Still accept them, still treat them well, but just watch out.
Right. Right. Yeah. Now asking for referrals too, because this is one of the things that's been taught for a very long time. Number one, do you ask for referrals on a daily basis? And I would imagine that your schedule alerts and patient identification really aid in this process.
They totally aid in the process. So one of the secrets of building a practice full of patients that you love treating is to never ask for a referral from somebody that you don't love treating. If you're only asking for referrals from your C patients, you're only going to get more C patients back. As a general rule, like refers like. And so when you have an A patient, somebody who respects the practice's financial policies and who respects the scheduling policies, and when you love treating that person, then that's the person that you ask for referrals from. In our morning huddle that you alluded to, that's where we kind of identify who we're going to ask for referrals from. And the reason is because our entire team loves asking for referrals. And so we don't want to overwhelm them. If 6 people are asking for the same referral from somebody, that can be a little strange, so we need to coordinate. So as we go through there, we'll look and we ask questions such as, okay, on this column of the schedule, who is it that needs to be built up? Who do we need to express a little more compassion, love, and care to today? Who do we want to ask for an online review from? And who do we want to ask for a referral? Who would we love to clone and duplicate in the practice? And so those are the kind of questions that we ask in our huddle, and that helps us determine. And then when we say, okay, we're going to ask for a referral from Kirk, then all right, who's going to ask for that referral?
Yeah. So can you give us a little insight on that too? Because sometimes when you're watching this, if you're first of all, you might be a practice watching this saying, well, we don't ask for referrals. How do you guys ask for referrals? And then you don't always ask for referrals and reviews from the same person, or typically do you?
Well, it just kind of comes out naturally for us. And so usually we wouldn't ask for both a referral and a review at the same visit. Though we've asked for referrals and reviews from the same people. So some people have said that you'll always want to wait for a compliment and then ask for a referral. That's an effective way, but sometimes it feels self-serving. I prefer to give a sincere compliment and then ask for a referral. Yeah. And so what I'd say is, Kirk, I've got to tell you, you've been coming here for the last 3 years, and it's just pleasant when you're here. You bring sunshine with you, and everybody else is so cheerful when you're in the office. Thank you very much for making this a wonderful place to be.
Oh, thanks, buddy. You just made my whole day. Like, I'm never leaving your practice ever.
Well, great. The lunch hall's just lunchroom's right down the hall. Yeah. Anyway, if you have friends or family members who are just like you, we would love to treat them. And I promise you, we'll take great care of them. Now, if they're not as kind and cheerful as you, I've got some business cards from a guy down the street, and I'd be happy to give you one of those. Yeah.
So you guys can see why everybody loves this guy. He's just authentic, honest, and nice. And I would imagine you just get a lot of hugs, too, every day from patients all the time. So it's good stuff. Now, any other pieces of advice or other items you would say on this particular topic when you're, creating a system to find the right type of patients, more of the right patients that you love to treat? What else would you say about this particular subject?
Well, with all systems, if you don't continue to revisit them, they'll become stagnant. Your practice changes, the individuals in your practice change, you change, the services that you offer change. And so you need to continually go back and update it. One of the best things that we've learned is when we have a bad experience from a customer service standpoint or from any other failure, we love to kind of do a post-mortem in our team meeting where we go around and we start all the way from the time they first scheduled the appointment through the appointment and then afterwards, and we look at what could have been done differently to change that appointment. Where were our system failures? Is there anything we can change that will kind of be a safety net to help us provide an amazing patient experience for the next case that comes in like that? Right. And so that's how we come up with our changes on the patient categorization. I mean, I'm sure we've changed this 20, 30 times over the last 5 years, but just make tiny little course changes, try it for a while, and when something breaks, work as a team to figure out where did it break. Don't think, we're going to throw this whole thing away. Just figure out what part broke, change it, and try it again.
Yeah, absolutely. And Nita asked the question, do you have a patient reward system for referrals?
I don't have any kind of formal reward that I give them a gift certificate if they come in. I know that there are different reward systems out there. What we do is we like to send a little handwritten card to the patient who refers them and just express sincere gratitude to them. That's kind of where I stand. I don't want it to be, look, if you refer X number of people, then you're going to get a trip to Hawaii or anything. That just is kind of my philosophy and my standpoint. Right. I just want people referring just because they love the practice and would love us to do it. So I don't really have a reward system. I'm not opposed to it. It just doesn't fit into my practice philosophy.
Yeah. And then just a small technical question. Do you sign it or does everybody on the team sign it?
Well, it depends on what we're writing, and so usually if they've referred somebody directly to me, then I'll say, "Dear Kirk, thank you so much for referring Bobby to the dental practice. I really loved getting to know him. I think I'm going to be able to provide him with excellent care. We really value you as a patient, and we're so glad that you would share our care with him." And then I sign it individually. We also encourage the team members, anytime they feel it, to send a random card out to one of the patients, or to, a whole nother system is post-op phone calls. And so the phone calls are a great time to make that connection and to talk to them and just thank them. A wise man said that gratitude is the currency that we should be using right now.
It is the currency for everything in the world. So on that topic, buddy, I'm so grateful for our friendship and for your wisdom. I mean, you work hard at this, and there's it's evident. So I just really appreciate that. Any final words of wisdom that you would have? Because I really value this so much. And, I think the important thing to remember is, as a dentist, this is the United States of America or whatever country you practice in, and you can choose how you want to practice. It's not chosen for you. Anything you would say on this topic of, finding more patients that you love to treat?
I just build on that. Make it yours, enjoy it, and have fun with it. Yeah.
So good, buddy. Well, I love this. So stay on for just a second here. I want to chat with you. There's a bunch of others. I want to actually do a whole nother show on the post-operative phone call because you do such an amazing job of that. So cool. So if you're watching this again, thank you so much. We've got some great questions today. Really appreciate the questions in the feed today. So thanks a ton. And as you have more questions that come up, you've been watching this, add them after the show or even later down the road, you'll see we'll get you the right answers for them and help you guys within your practice. So until we see you next time, keep watching the Best Practices Show. You guys have a great day. Stay on for a second, Ken.
Thank you.